Hi everyone, thanks for joining us today on this webinar for Critical Care Transport 3rd edition. My name is Ryan Poor. I'm a marketing manager for the Jones & Bartlett Public Safety Group. With me today are our three authors for this title, Mike McAvoy, Sean Kivlahan, and Jeff Rabrich, as well as on our panel, Tiffany Slitter, our manager of content strategy, and we will also have another person from our sales team joining us shortly. So just to quickly go through what we're going to cover in this webinar, Mike, Jeff, and Sean are going to do most of the talking, but we're going to start with a quick run through of their respective backgrounds. Then Mike is going to dive in a little bit to the history of this textbook. And then we're going to do kind of a deep dive into what's new with each of the chapters in this new edition. Laura Carney from our product team will also talk about the Navigate packages and pricing at the end. And then we will also have time for Q&A. So without further ado, I'm going to hand it over to Mike to start us off.
Thanks, and thanks to everyone for joining us. We want to just give you a little rundown of the three lead editors for this edition, and I'll talk about my background a little bit. I'm a paramedic, a nurse, and an educator in critical care. Been involved in this textbook since its inception, actually, and work as a EMS coordinator in Saratoga County, New York, and then clinically as a nurse clinician in adult and pediatric heart surgery at the Albany Medical Center in New York. And then my EMS involvement is with the Clifton Park and Half Moon EMS organization in Saratoga County, New York, and I do a lot of the CME coordination for them and work as a paramedic supervisor. So that's, in a nutshell, that's my background.
Hi everybody, Sean Kivlahan, and briefly about my background and bio. I'm an emergency medicine physician. I am currently working at Brigham and Women's Hospital in Boston. I'm faculty at Harvard Medical School and also the Harvard School of Public Health. And prior to residency, I was a New York City paramedic and EMS instructor for several programs for about 12 years, and still continue as an EMS World editorial board member. And I also work closely with the World Health Organization and several NGOs on their emergency care and trauma programming.
Thanks everyone for joining us. I'm Jeff Rabrich. I am also an emergency physician as well as a EMS physician. Like Sean, former New York City paramedic as well. And I'm involved in medical direction for several EMS agencies in the Hudson Valley region of New York, just north of New York City. Vice chair of the New York City REMAC and a member of the CMAC and SEMSCO in New York. I also do a lot of work in EMS with tactical and operational medicine. And do some work with the federal government with that. And as with Mike, I've been involved in this textbook from the beginning as well.
So I wanted to give a little bit of history of how we got to the 3rd edition, and obviously that includes a 1st edition and a 2nd edition. And really how this came about is the three of us are all friends outside of the book, and that helps us work together quite a bit better than you would if you were just thrown into a textbook and have to work with folks that you don't know. But back in 2007, Jones & Bartlett came to myself and Mike Murphy, who is a retired fellow from Rockland Paramedics. And he wasn't retired at the time. He was actually running Rockland Paramedics operation in Orange County, New York. And they asked if we had anybody who could write or rewrite a chapter on intra-aortic balloon pumping. And that was something that I had published a great deal about. And so I was able to turn the chapter back around to them in a couple weeks' time, which prompted them to come back and say, do we have anybody who could work on burns? And Jeff Rabrich was in his fellowship for emergency medicine at the time and looking for things to do. And he took over the burn chapter, having had a pretty good amount of experience with that in the critical care transport environment. And ultimately, we were asked by Jones & Bartlett to pick up the rest of the book and get it finished because it had been kind of languishing for several years at that time. And so myself, Mike Murphy, and Jeff Raybridge were the lead editors, and finally published a book a couple of years later in 2009. In 2015, in the summer, we started work on the second edition and did some interesting things in that book, which were sort of landmark publications in the EMS world, not to mention the critical care world. But we reordered the chapters at that point and added a chapter on safety, which Jeff Raybridge and some of his colleagues authored, and sort of became a lead outline for safety in not only critical care, but in the EMS field. We also added a section on bariatric transport, since that was something that seemed to be happening a lot, and put a chapter in the back of the book on special situations that included things like excited delirium, which was a hot topic at that time, and certainly a controversial topic now, and put some more information about children with special needs and some of the equipment that those kids are using at home and using in interfacility transports that people don't encounter all that often. And so that work started in 2015, and we published the second edition in 2017. And Murphy retired right after that point, and so we were kind of looking for another author. And in the second edition, Sean Kivlehan had helped us a great deal with editing some chapters and revising chapters, and so we thought he would kind of be the ideal fellow to recruit as our third editor. So we pulled him into the mix, and it is interesting the change between the second edition and the third edition. And what you'll notice when you actually look through the book is that the complexity of the material has moved up so high based on what we did in the first edition to where we are now in the third edition, that many of the authors are actually physicians and paramedics themselves. And we had to pull people in with that body of expertise because of the complexity of the material. We also got a new editor, Mike Boblet, who was just an absolutely fantastic fellow to work with. I don't know that he knew too much about critical care, but I'll bet you he could hop in the back of a helicopter and take care of a patient now after all that he went through with us. So, and we're happy to say that that book is just recently published, and we want to just take a run through and talk a little bit about what's new and what's changed in that textbook, because it's pretty significant.
Yeah, and just quickly before we jump into that, wanted to mention this. If anyone has any questions for any of our authors or any of our panel members, there is a questions box in your GoToWebinar kind of control panel. If you just click that drop down, you can enter questions in there. If someone on our panel can't answer it during the presentation, we'll get to it during the Q&A at the end.
So I want to just briefly talk about chapter 1 and chapter 2. So our intro chapter has some new information about, if you're not aware, if you're a nationally registered paramedic or EMT, you probably notice when you log in on their site now that you have a national EMS ID number, which links into the same database that physicians and nurses are using. So we put some information about that into that chapter. We also spent a lot more time in chapter 1 in the whole realm of quality improvement, quality insurance, and talking about what can be done to improve the quality of care in critical care transport. And part of that was to enhance the section that we call transport choreography, which talks a little bit about that dance that gets done when a critical care transport team arrives to pick up a patient and gets report and moves the patient from the hospital setting to the critical care transport unit. In the second chapter on medical legal, Matt Strieger is an attorney who probably a lot of you are familiar with. He basically, from soup to nuts, revised the medical legal chapter. He put a lot of new information and case information about litigation that's occurred around EMTALA and talked a great deal about HIPAA compliance and some of the things that are true and untrue when we talk about HIPAA. So that's a pretty well from start to end rewritten chapter in the textbook.
And then chapter 3, so this is our patient safety chapter, and as Mike alluded to earlier with the overview of the editions, this was a new chapter in the second edition, and we received some very good feedback on this chapter. So what we've done in this edition is we've updated a lot of the discussions on medical errors and reduction of errors in the critical care transport environment. We've spent some time on error reporting requirements, different databases that are out there, and identifying trigger tools that can prompt investigation. We talk very specifically about some EMS quality measures that are out there, some of the NEMSQA measures and others, and highlight some of the problem areas of patient safety specific to the transport environment that have occurred and that we've seen since the second edition was published. So that chapter is more expanded now and still is a very comprehensive discussion of patient safety in general in healthcare, but specifically to the transport environment. And then in chapter 4, this was our aircraft fundamentals and flight physiology. And what we did here is we've expanded and focused the section on discussions of incidences and accidents and causes of air medical crashes with a heightened focus on safety, crew resource management, and safety reports that are out there, and procedures that can be used to help maximize safety, both for the patient and the crew in the airport, in the aircraft transport environment, as well as all the basic stuff that was there already on physiology and fundamentals of flight.
Chapter 5 is the patient assessment chapter. This is another chapter that we really redid from the ground up. We got two great people to tackle it and effectively start with a clean slate to modernize it and to the approach of assessing patients in a critical care environment. So it's Kevin Colopy and Vahe Edler, who are both active flight paramedics and educators in large flight systems. So they're doing this work and training people every day. And we asked them to focus on what are the important aspects of patient assessment in the critical care transport environment. We didn't want to just repeat everything that's in an EMT or paramedic textbook. That was one of our big goals. Taking the assumption that people taking these courses already have the foundational EMT and paramedic training. How can we add to that? What's different about this? And that's really what that chapter tackles. And I think they did a great job updating the approach, and then also some of the new inputs, objective technical tools, measurement tools, decision tools, and some of the new equipment that is surfacing in the pre-hospital field, particularly point of care ultrasound as that's coming in more and more. Chapter 6, and also I'll say chapter 7, which will be on the next slide, was another big change that we took. So one of the key things that critical care transport professionals have to deal with is managing ventilation and all the aspects of care related to that. And that's often a big differentiator from what they're taught in the paramedic programming, where the focus is more on emergent airway management techniques and stabilization. So we decided to split what was previously covering all of that material into 2 chapters. So chapter 6 is respiratory emergencies, and with a focus of airway management. Again, taking particular care to not just repeat things that are in the paramedic textbook. We take the assumption that our students have already mastered that, and then we add on new techniques, new equipment, or new methods to focus on that they're more likely to encounter in these critical care environments, both field response and interfacility transports. And then the next slide is the chapter, what was the second half of that chapter, ventilation. And this is just such a huge topic, and feedback that we've gotten from people is that it's something that is largely new to people who take this class because they know how to manage an airway and intubate, but these long-term vent settings, the many, many different types of ventilator approaches, the different types of vents that are out there, and all the things that can go wrong during particularly interfacility transports where they may have to manage a patient who's been in the ICU level of care for some time. We broke that down and tried to explain it from the ground up. And this is a largely rewritten chapter as well that I think the readers are going to find very, very useful and true additive information that is really not covered in the paramedic level curriculum or textbooks.
So chapter 8, we recruited a pharmacist who really took a hard look at the way the chapter was organized and paid a lot of attention to the pharmacodynamics and the physiology of the medications that were being used. And we had structured that chapter previously according to the uses of medications. And we kind of stayed with that, but at the same time, we had to add some new medications in there. Probably not things that are encountered like frequently by a critical care transport provider, but when you do run into something like methylene blue being used for a patient with refractory shock or angiotensin II, you definitely want to know a little bit about those before you roll into the door and find that those are infusing on the patient that you're going to transport. So we tried to make that chapter more comprehensive. We focused in on eliminating medications that you just don't see anymore that were there, and try to put some information in there that is particular to the uses and the titration of the medications that you see.
And chapter 9, this was our lab analysis and diagnostic study chapter. And what we did here is, we got a lot of feedback on this chapter, and especially on some new technologies that are out there, and how could we make the lab information more meaningful for the critical care transport provider. So there's expanded discussions on some of the lab analysis and the meaning of some of the abnormals. We also expanded the discussion on coagulopathy and put in a new section basically on factor 10A levels and the use of TEG or thromboelastography. We're seeing this being utilized more and more, especially in trauma transport, so we expanded that section. And then we did a lot of work on the diagnostic imaging, as Sean mentioned earlier, with point of care ultrasound. The use of ultrasound has dramatically increased, particularly in the field since the last edition. So a lot more coverage on ultrasound, its increasing importance, and some of the standard tests that can be used, in addition to enhancing the CT section and even some information on PET and cardiac imaging as well. So a much more comprehensive overview of different modalities that are out there, as well as the newer lab tests that are being used in transport.
So 10 and 11 cover resuscitation, shock, and then trauma. And chapter 10 in particular covers the approach to all the different types of shock, the management of shock. This has been updated. There's been a lot of changes since the prior edition. I wrote the chapter in the prior edition, and there's just been so many advances in this field that it really needed a big overhaul. So we did a pretty detailed updating of it, in particular covering updates on transfusion medicine, the different types of blood products. Again, one of the things we try to do over and over again is really focus on areas that are added value to people who have already completed a paramedic or nursing course, things that aren't covered in detail. And that's why in this chapter, focusing on blood products and the different approaches to transfusion therapy were so important. Also really updating, as Jeff mentioned in the prior chapter, the factor 10A inhibitors and all the new class of DOACs and anticoagulants that are becoming, that really in the past 5 years have changed the whole approach to managing these types of medications and their relationship to trauma. So updated that with a new easy to use chart. For trauma, updating some of the new techniques, in particular REBOA, which is something we're seeing more and more. And this is in particular interest to critical care transport professionals because they're going to be transporting patients who may have had something like this placed at a smaller hospital to a larger facility. And these are new techniques and new equipment that have really come out in the past 5 years or so. And also just all of the trauma guidelines from various councils that have been updated over the past few years, getting everything up to date. So two other pretty big overhauls.
In chapter 12, so this is our neurological emergencies. So, there's been a lot of things that have changed since the second edition, particularly the importance of, LVO and comprehensive stroke centers, as well as, decision tools to determine LVOs and transport. So we've updated the chapter. It reflects all the current AHA and ASA metrics, TPA, endovascular treatments, and then There's a whole new section in this chapter on ICP waveform interpretation. This was one of the things we got in our feedback from the second edition, is that as we started working on the third edition, more and more people were asking for information on ICP waveform interpretation and how important it's become. So there is a new section in there on those interpretations in the Neurological Emergencies chapter. And then chapter 13 is our burn chapter. So again, here we updated burn management and assessment, including, the focus on fluid resuscitation and how that's changed over the last several years, as well as analgesia and even airway management in burns, and how the thinking in airway management in burns has shifted a little bit since the previous edition. So that's all updated to reflect current burn treatment guidelines.
Then we did some splitting up of some of the cardiac chapters. We had previously combined the electrophysiology with devices, and we separated that out to be its own chapter to talk about EKGs and some advanced cardiology topics. We put some information about newer pacemakers, leadless pacemakers that are implanted directly into the ventricle or atria, some updated troubleshooting information about ICDs as those things have continued to evolve, and then some new information about fairly common both intraoperative procedure during cardiac surgery and can be done independently, and that's left atrial appendage ligation to treat chronic atrial fibrillation in patients. And because of the frequency with which that's being done, we felt that it was a wise idea to add some information about that procedure to this chapter. Then I mentioned that we had done some splitting. So hemodynamic monitoring previously was combined with some other topics, and we really have updated this chapter to reflect the less invasive equipment that's being used now for hemodynamic monitoring, and to focus on some of the concepts that look at fluid volume status in patients by the percentage change in the arterial waveform trace, pulse pressure variation that's called stroke volume variation, stroke volume index, less invasive sorts of parameters that are becoming more common as a tool for assessing fluid volume status in patients. And then we also focused on the conventional, more invasive equipment that's being used. In chapter 16, we recruited some authors from University of Michigan, as well as an expert from the University of Rochester, to completely rewrite the mechanical circulatory support and give it its own chapter. And we felt that was important because ECMO had previously been included in with balloon pumps and lumped into the hemodynamic monitoring chapter. It's become its own specialty with its own set of expertise. And so in that mechanical circulatory support chapter, we basically cover devices that are temporary, such as ECMO, the Impella, intra-aortic balloon therapy, as well as more permanently implanted devices like total artificial hearts, LVADs, RVADs, things that people may be in transport with, but not necessarily their chief complaint, so that the crew knows how to manage those devices during transport. So that's a brand new chapter with a great deal of information about things that are contemporary in the transport environment. When we did the last edition, it was difficult to move a patient with an Impella or to move an ECMO patient, and that's become commonplace now. The equipment has shrunk in size, and the ability to mount it inside transport vehicles has changed so much that those have become commonplace practices. So we felt that needed its own chapter in the textbook.
So 17 and 18, so GI emergencies, general urinary emergencies, covers all things urology as well. Been a lot of updates in this, basically on decision tools and certain interventions that can be done, interpreting assessments in labs and new radiographic images. And this is for both. In particular, there's been some major updates to the approach to diabetic emergencies and DKA in particular, and also HHS, updated to reflect guidelines, best practices, and really shifting the focus again away from that immediate assessment and treatment that is covered in a paramedic curriculum to the longer term management for as these patients are being encountered more mid into their treatment course, and how to respond to changes in lab values or unanticipated disruptions in their care.
And then in chapter 19, which is our environmental emergencies chapter, we really took a new look at this chapter, this edition, and we recruited a new author who has extensive experience in wilderness medicine and prolonged field care, and really expanded and updated a lot of the discussions in there, particularly on dilutional hyponatremia, heat stroke, frostbite, hypothermia. It's really been updated and expanded and meets all the wilderness medicine guidelines and all the other information that's out there for best practices in environmental emergencies.
So infectious diseases was also really kind of overhauled significantly. This is a huge topic, and obviously as we're editing and writing this edition, COVID was raging, so it was on everybody's attention. But we made it a point to not make this just a COVID chapter, but to make it an infectious disease chapter that covers COVID as one of the many, many types of infectious diseases that are encountered. We updated a lot of the newer treatments to infectious diseases, of which many, many have come out over the past few years, specifically about targeted monoclonal antibody therapy, not just for COVID, but for other diseases as well. Updated our approach to immunocompromised patients, as these types of patients are becoming more and more commonly encountered as transplant volume grows and a lot of immunosuppressive medications are used for various conditions. So that required a major overhaul that was performed. Updated other commonly encountered infectious diseases such as different types of cellulitis, abscesses, HIV patients. Updated the antibiotic discussion to reflect new guidelines from antibiotic algorithms and groups on antibiotic stewardship. And of course, did a fairly big update on personal protective equipment and decontamination and other protective measures that can be taken both for providers and for their patients. This includes all COVID guidance, but also expanded to really cover everything, just recognizing that while COVID is here now, there's many other things in the future. So but it does cover everything up to date with COVID as well.
And then chapter 21 is our tox chapter. Again, went through there, we've been lucky to keep the same toxicologists involved with multiple editions. So they've gone through and updated the discussion on poisoning, drug overdoses, some of the newer drugs of abuse that have been seen, and really updated treatments for those. Chapter 22, this is the OBGYN emergencies. So what's different here is there's really a very detailed overview now of fetal monitoring, assessment, fetal circulation problems, management of cardiac arrest in the pregnant patient, and medical conditions related to pregnancy and delivery. That's been updated and expanded. And then in chapter 23, which is neonatal emergencies, again, we had a good group of authors on these who had involvement in creating the guidelines. So they were able to update neonatal guidelines in the chapter to make sure they reflect all the current guidelines for therapy that are out there, as well as a discussion of specific issues for neonatal transport with special ventilatory therapies. So whether it's ECMO or nitric oxide or high frequency ventilation, things that may not be encountering every day if you're not doing a high volume of neonatal transports. We really have an expanded discussion on these therapies and devices for the neonatal transport.
So chapter 24 in the Pediatric Emergencies chapter, we recruited a new author who is both an emergency medicine and a pediatric physician, and spent some time in that chapter really focusing on mechanical ventilation for pediatric patients and how you would make vent settings very different than what you do with adults. And some of that special information is focused now in the pediatric chapter. And then as well, there are a host of things that we use in the pediatric population differently for assisting ventilations and assisting respiration. So we put a host of new information about that into the pediatric chapter, and then focused in on shock and shock management, like it has with adults, as Sean was mentioning, has changed considerably in the pediatric world. And so we updated that information so you have the latest and greatest in that environment. And we're all going to talk about this chapter because I think the greatest controversy broke out with having to manage a new discussion about excited delirium and dealing with agitated behavior and choosing the words that we wanted to use to describe that based on the controversy that's swirling around the medical literature and the legal literature. So we actually were the first textbook in the United States in the EMS world, the critical care world, to describe how agitated behavior, like excited delirium, if you want to use that word, would be managed. And the authors of that original chapter back in the second edition were the folks from Wisconsin, who both on the ground and in the air had some pretty extensive experience using ketamine to manage that patient population. So we updated that with a lot of the new controversies that you're reading about and hearing about, and a little bit about dosing and the whole concept of post agitated behavior management and what you need to do with an individual who has been sedated and is now being moved and still is suffering from hyperthermia and excessive catecholamine release throughout their system. So
Yeah,
go ahead, Jeff.
I was going to say, Mike, yeah, I think, you said it well. What we did is, we acknowledged the physiology and the disease processes occurring, but also at the same time, have a parallel discussion in there about the controversies about it, and, which are more so about the naming and whether it's its own entity or not. But, we really updated the medicine of it and dealing with the agitation and the management, but also addressed the controversies, with a little bit of kind of foresight into the future. Again, we don't know where that controversy and discussion is going to go, but, we really updated the medicine there on that, as well as the controversy. And then, if you remember, this was kind of, three different things in one in this chapter. So the special situations, I think we really expanded kind of the special needs children, which, in the last 6 or 7 years since the second edition, so much has changed in that arena as well. I know we've talked about, the specialized equipment and miniaturization of some of the cardiac equipment. Well, the special devices for pediatrics and, that's grown tremendously, whether it's pediatric GI stuff. So we've really kind of enhanced that discussion on dealing with the technologically or medically complex child in transport. So that's another area that we looked at in this chapter as well.
Yeah, and the last part of this chapter, which is a little bit of a catch-all chapter for these really important topics that just didn't clearly fit in somewhere else, is bariatric patients. And this covers both all the different types of bariatric and weight loss surgeries that can be encountered and the complications that are common to each. But even more importantly, it talks about the management of bariatric patients, which is a really growing challenge for EMS and transport agencies for a lot of reasons, just pure logistic reasons, but also dosing changes that need to be made to medications and equipment changes that need to be made, and protection from injury of providers themselves. So it's a huge topic, and we did, I think, good justice to that by really expanding it in addition to these other important issues that are covered in this chapter.
All right, so Laura, I believe this is your slide. You're going to talk briefly about the Navigate packages for this book.
Yes, thank you, Ryan. So for the updated third edition of Critical Care Transport, we offer a variety of instructor and student support. There are two options available for Navigate, Essentials and Advantage. Both packages include assessments, analytics, slides, course primer, flashcards, and practice activities. In addition, the Navigate Advantage package includes access to an ebook and test prep. The test prep for this third edition has been heavily revised and reviewed by subject matter experts. New for this edition, both packages offer an audiobook. For instructors, we offer an online instructor's toolkit as well as an online test bank. These resources are available now, and the Navigate packages will be available this week.
All right, awesome. Thanks, Laura. All right, so without further ado, we are ready for Q&A. So let me just go ahead and unmute everyone. So you can, if you have any questions for any of the authors, any of the members of our product team, anyone from our sales team, I just unmuted everybody. I do believe you still have to manually unmute yourself if you want to speak up, but you should have the ability to do so now. We also do have the questions box if there's any questions you want to type in. But if anyone has any questions, this is a good time to ask. And I actually just got one in the box I'll read out. How does the book align with the newly released CCT core curriculum from ASTNA?
That is a good question. One of the things that we did with all of our authors is we took the criteria from IBSC as well as ENA and the other two groups, the physicians group, ACEP, and the National Association of EMS Physicians, and anything that was pertinent to critical care transport, we asked our authors to make sure that that's included in the chapter. So I think you'll find that this newly released blueprint is pretty well covered in the textbook.
And that's some of the feedback we got in earlier editions to make sure that we were more, aligned with those. And I think, as Mike said, we paid a lot of attention to that this time around.
So if anyone has any other questions, you can type them in the box, or you should be able to unmute yourself now if you want to ask over the phone. Just give me 1 minute here. I just got another in the question box. Use of the textbook versus training materials provided. Does this meet the 120 hours for IBSC?
I'm talking about the 120 hours for original certification that's recommended.
I'm guessing yes. Kevin Wilson, if you want to unmute yourself and speak up, can clarify, but that's what I've got in the box here.
Okay, there we go. Sorry about that. So yeah, we're starting a new program out here on the Oregon coast, and we're having difficulties with a lot of this because we're in a low resource environment. So getting materials and sourcing materials is kind of a plus, not to mention cost and validity of cost is a massive issue out here on the coastline itself. So we're looking at creating the program, but we're going to go through the IBSC, and it's 120 hours is required. So we can do it a hybridized mode. With your guys' essential course versus the Advantage, the main thing is the Advantage going to give us the 120 hours pretty easily, or are we looking at the essentials for cost effectiveness? This is kind of my main thing.
Hi, this is Tiffany. Yeah, I can jump in here. So we don't offer a full curriculum mapping or blueprint for you to follow specifically, but we do provide an instructor primer document that provides some helpful guidance around setting up a program. There's certainly enough content included to get to those 120 hours. That's not a concern. I think to Mike's point previously, there's direct alignment with the IBSC blueprint. So, knowing that book includes all the content covered there, our Navigate resources match what's covered in the textbook. So for the essentials, you're going to get basic test bank, audio book, access to practice activities for the students. When you go to Advantage, you're going to get test prep, which I think, based on what you're saying, might be the best way to go, because that'll give you a fully revised set of question items that are especially designed for students to prepare for the certification exam, for the IBSC exam, written to the appropriate ratio of topics and written in the proper style. They've been reviewed by an expert group of authors. You know, Mike, Jeff, and Sean were also involved in updating our test prep. In addition to that, you'll get the ebook with the Advantage. So I'd say if you're looking for enough content to help fill those hours, Advantage is your way to go.
Okay, great. Thanks so much.
You're welcome.
And there is another question here. I'm just reading through the box as we've had a few more come in. Question from Matthew Sylvain. Military CPGs are a hot topic right now, especially in the area of pre-hospital blood transfusions. Could you speak to how closely related these practices are to the revisions in the 3rd edition?
I can comment on that. So they're covered, and as you know, a lot of the recent research on the transfusion best practices has come out of the military. In fact, you know, the overwhelming majority of it, with few exceptions. So most of it is based on military best practices and CPGs. We discuss them, but we also outline any differences that are there. So they're covered, but also other civilian guidelines are covered, and kind of pros and cons of different approaches, including whole blood use and all the related topics is all covered as well.
Right, and I think it focuses on there things like that you might find in military guidelines, like setting up walking blood banks, things like that. You know, were not included in this edition, but more the, you know, which products you would use and when, and those would be in alignment.
Thanks to you both. Another question here, probably for either Tiffany, Laura, or Brian. Question regarding the Navigate Advantage features. I redeemed my code April 20th, which means that my access to the extra feature expires April 20th, 23. However, the Navigate features aren't available yet. Will we be able to have that expiration changed to grant a full year of access?
I can't speak directly to this, Brian. I think you know how to do that, though. The easy answer is absolutely. Just reach out to your rep, anyone on our sales team or support team, even if you just call our tech consultants, they can help extend that code for you. Our sincere apologies on the slight delay. There was a platform issue with Navigate, but we're all set now and we should be ready to roll by the end of this week.
Yeah, this is Brian. If you have your name in the chat, I can certainly get that updated code over to you as well, or update yours, depending on how we want to play that out. But either way, to Tiffany's point, we'll take care of that.
Yep, that was Charles Patterson, Brian. I don't know if you want to make a note of it.
Excellent, thank you.
Also have a question. Could we get some info about the 3rd edition instructor slides? Tiffany or Laura, I don't know.
What information specifically would you like about those? Can you provide?
Yep, Marie Wilkinson, if you're on, do you want to chime in? Laura, what about just like some general info on what's in there?
So the slides will provide, you know, basic summary. Think of it as like the Cliff's Notes for the book. They're broken out by chapter, so there's a PowerPoint file for each chapter, highlighting the key concepts, a lot of the critical content, especially that Mike, Jeff, and Sean highlighted today. Those key updates will be included there, along with instructor notes. Those instructor notes are also found in our lecture outlines, which you'll also receive, and those lecture outlines will really walk you through how to present the slides to your students. The slides are also a really great study tool if students want to use them directly to study, since it highlights the most critical information. Also includes a lot of the photos and art from the book, which is a really helpful learning tool as well. Those are available now. So our online ITK is currently accessible. So if you want to request an access code for that, you can view them immediately after this webinar. And they'll also be included in the Navigate courses.
Thanks, Tiffany. I have a question here from Andrew Tiernan. So like the previous editions, the blueprint will lay out the hours expected for each chapter's didactic. We as course builders can then fill them in with our clinical portions, correct?
I'm not sure who should jump in on that. I would say absolutely, yes. I think that's the expectation. As I referenced earlier, please take a look at that instructor primer document that we pulled together. I think that's your best starting point before you start running a new program.
Thanks, Tiffany.
Yep.
I think,
next-
you know, one other thing just to mention about that is that if you look around the country, you're not going to find any two critical care transport courses that are the same. Jeff, Sean, and I have all been involved in teaching courses in different places, and it really depends on the types of patients that are being moved and the equipment that those people are attached to, what's going to go into that course. And I think it's very difficult to teach the whole entire book from beginning to end, because there's an awful lot of that material that you find wouldn't be applicable to everybody who's in the room. So, you know, I think we talk about running a curriculum, and when Oregon talks about putting on a CTT class, I think that'd be very different than one that you do in Long Island. And so that's something just to keep in the back of your mind. You know, we make recommendations in the textbook as to how long it would take to cover certain pieces of material and what the clinical component of that should be, but it can't really be something that you live by or die by.
Thank you. Do have a question here from Daryl Fixler. How can I be added to your database for next edition to help with subject matter? Laura, I don't want to speak for you, but I believe that's something you could speak to.
Yes, thank you. We're always looking for subject matter experts and for reviewers. So if Ryan, you're able to send over contact information to me and Tiffany, we'd be happy to reach out both for this as well as many other projects that may arise.
Yeah, this is actually a good chance for me to mention this. When everyone closes out this webinar, there will be a survey that will pop up very quick. But one of the questions there will be if you have any kind of follow-up questions or any kind of follow-up items you want to get in touch with one of us regarding, you can put that in there and we'll try to follow up with you. So Daryl, maybe if you could just put a quick reminder in there and we'll reach out to you. There's no more questions in the box unless anyone wants to speak up and ask any over the phone or type in any last minute ones. We'll give you a moment here.
Guys, I just want to say thank you for your work. I've used all the 2 editions so far and looking forward to this 3rd edition. So thanks for your efforts.
Thanks.
Thank you.
Hey, Ryan, I just wanted to add, if anybody does need instructor materials or updates or anything like that, just have the instructors reach out to their representative as well. If you're not sure who that is, you can certainly reach out to us. We can connect you or to our website as well that can guide you also. But we'll validate that they're an instructor and also get the materials to them, you know, that they might need at that point.
Also did have one question come in from Christopher War. I might have missed it earlier. Do we have a shipping date for the books?
The book is out there. It's ready for you. So as soon as you place your order, you will receive your copies. It's at the warehouse, ready to go.
The other thing that I would mention is Jeff and I spent a great deal of time. We cajoled Sean into spending some time on test questions. And so one thing we can say about this edition is that the test bank that's included with it is vastly improved over what you have seen previously. And I know the instructors out there are going to be thrilled with the questions. They're very appropriate, and we really put a lot of energy into making sure that they tie into things that you'd really see if you were taking a board exam.
Yeah, thanks for mentioning that, Mike. This is good time to remind everybody that the pass rate for the critical care certification exams, both of them are very low pass rates. And everyone's constantly in search for more test prep material. So we certainly prioritize that with this edition. And I hope that everyone finds those resources to be extremely valuable. Of course, any feedback you have, never hesitate to reach out.
Yeah, if anyone else has any questions, last chance to speak up or put them in the box.
That was good. I will say that the three of us have a lot of fun doing this, as rigorous as it is. As I said, we're good friends outside of what we do with the book, and it is good to have a good working relationship among the authors. We're very proud of each edition that comes out and more proud of each one.
Awesome. Well, I don't think we've got any other questions. Like I mentioned, when you close this webinar out, there will be a survey. If you do have any follow-up questions, I'm going to pick them up in about an hour, share it with the group, and we'll try to touch base either later today or tomorrow. But thanks again, everyone, for taking the time for joining us. Thanks to Sean, Mike, and Jeff for their time. And thanks to the rest of our panelists for being here, helping with the questions.
Thanks so much, and thank you, Ryan, also for coordinating all this.
No problem. All right. Well, hope everyone has a good remainder of their Tuesday, and hope to see everyone soon.